just put my bag on the bed. Okay. Oh dear. How are you feeling? Yeah. Okay. Yeah, you do look a little bit poorly. Alright. Oh, you're burning up. Okay, well I came as soon as I could. Right, let's take a look at you, shall we? Alright, just to begin with, I'm going to take your temperature. I'm just going to give it a little clean. Alright. I'm just going to do this a couple of times. Alright, one more. Alright, well you've definitely got a fever. Okay. I'm just going to have a little listen to your chest. Okay. Just going to move your top. Perfect. I'm just listening to your heart. Okay. Can I just have your wrist? Let's just have a feel of your pulse. The other side. Thank you. Alright. Slightly elevated heart rate, which is perfectly normal for a fever. Okay. Right, let's listen to your lungs. See if we can work out where it's coming from and how to treat it. Okay. So I'm just gonna ask you to take a deep breath in for me and out, and in and out, and in and out, and in and out, and then just gonna feel around the back. And that's a nice deep breath in and out, and in and out. Okay. There's a little bit of mucus on the chest, but nothing out of the ordinary. Okay. Right, so I'm just going to check your blood pressure. Alright, which arm? Let's do this one. Okay. holding. All right. Blood pressure is normal. Okay. Perfect. All right, I'm just going to take a little look over you. Okay, put some gloves on. Okay, just going to look at your face. Look at your eyes. Just around the face, the ears. Let's have a look. Neck. Looking at the lymph nodes. Okay. A little bit swollen on this side. Let's have a look at your shoulders, your arms. Your hands. You are very clammy. You're feeling very hot. Okay. I'm going to see if I can help bring your temperature and your fever down. Okay. Okay, just going to place this around your neck. just over the forehead. And on the neck. And then a little bit of cold spray just over the head. And on the hands. Make sure this is the right one. Right, this is going to really help open your airways. Okay, nice deep breath in and out, and in and out. Alright, just want to adjust you a little bit now and make sure you're nice and comfortable, okay? So I'm just gonna move your head. Just make sure your shoulders, press those down a little bit. Down the arms, just help ground you into the bed. Encourage you to close your eyes. Just like that. Perfect. Now, I'm going to have a look at your eyes because I just want to make sure that you're not going into a deeper fever, which can sometimes make you feel a little bit confused, a little bit dizzy. Okay, so I'm going to check your eye function and make sure everything's as it should be. Alright. So I'm just going to come in really close now. then looking to the left and to the right. Let's try the other side. Let's do the same way. Okay. So looking up, looking down, looking left and looking right. Just blink a few times. Alright, so I'm gonna just have you look at my nose. I'm just gonna check your pupil response. Okay, just close your eyes and blink a few times. Okay. I'm just gonna have you following the light and back from top to bottom, bottom to top, and then I'm going to do some swirly lines, and then again, and then again. Okay, just closing the eyes, just blinking. Right. I'm going to cover one of your eyes and I'm just going to check. And the other side. Perfect. I'm just going to have you tell me how many fingers am I holding up? Perfect. Okay. So, I am not concerned that your fever has progressed. You're clearly suffering with some sort of virus, okay? So all I can advise is that you keep hydrated and rest. And I believe the fever will pass by tomorrow, okay? I can see why you were worried. It is always very worrying when we suddenly have a fever, okay? I have some tea. Okay, I'm just gonna get that for you. Alright, so I'll just pop it here. Okay. was made for you just as I arrived, so that will be perfect to drink now. Okay. I'm just going to take your temperature again. This one's going to go in the mouth, so just opening and then just closing the mouth. Let's just hold this here for a second. Okay, that's dropped a lot. I'm going to check with the thermostat. Okay. I'll do it 3 times. Alright, it's still high, but it's come down. If you're still feeling a little bit anxious, I can stay a while. Yeah, just while you fall asleep. That's okay. Just think of all the people in that aeroplane you can hear, where they might be going on their holidays. What they might be doing, watching TV, reading a book, having some lunch. All those people with their intricate lives. And here you are, relaxing, because right now you are completely safe. Nothing bad is going to happen. Alright, so I'm gonna just have you look at my nose. I'm just gonna check your pupil response. close your eyes and blink a few times. Okay. I'm just going to have you following the light and back from top to bottom, bottom to top, and then I'm going to do some swirly lines, and then again, and then again. Okay, just closing the eyes, just blinking. Right. I'm going to cover one of your eyes and I'm just going to check.